I'll step out from behind here for a second. So, just to introduce myself, for those of you all that don't know me, I am a native of St. George. I am not anybody special. Anybody know where Grover is? Yeah. I grew up in Grover, and a lot of people say, well, who's your people? So my father was Harold Singletary, right there from Grover. My mother is Sarah Singletary. She was Sarah DeReef. So I married Andre Douglas. His mother was Barbara Douglas Lawton. And so I am born, bred, and raised, well, maybe not born, but bred and raised right here. So I am no stranger to you guys. I am here for you. The reason why I've been in healthcare since 2002. I currently work for Trident Health Systems in internal medicine. And so the reason why I pursued an education in diabetes management and diabetes education is because, you know, you see a lot of that in healthcare, but until it actually impacts you personally, sometimes we don't take things as seriously. And so I lost two people really close to me to diabetes and some other health issues that we will get into today. But my father passed away as a result of poorly managed diabetes, and so 7 years ago. And then 2 years later, my mother-in-law passed away from the same thing. So I said, you know what, I'm determined, you know, if I can help somebody, I'm gonna do that. So I'm here to help, because I don't wanna lose anybody else, you know, and if I can help you, now it's up to the individual. So I'm here to help, I'm here to guide you on the journey, because this is not a death sentence. It's a change of life. It's a lifestyle change. How many of you are familiar with diabetes and what diabetes is? Are you familiar with it? Okay, anybody diabetic? Anybody have family members diabetic? Okay, so you're familiar with the disease. And that's what it is. It's a disease. And with that comes a lifestyle change. And a lot of that comes with modified eating and modified diet, you know, your diet, your health, you know, your weight. You know, you have to modify a lot of things with this disease as with other things. But we're gonna try to stick with diabetes today. So let's talk about some myths about diabetes and some facts about diabetes. Can anyone tell me what the number one myth is about diabetes? The number one myth is that you can catch it from somebody else. So a lot of people think, oh, I've been living in the household, you know, with my mom all my life. She's got diabetes, I'm gonna catch it from her. No, you can't catch it from her because you eat from the same pot or you may drink from the same glass, but it is genetically able to be passed down to you. It is hereditary. So my story is I'm not diabetic, hopefully will never become diabetic, but I have a family history of diabetes. Both my biological parents are diabetic. And when I found that out, and I say biological because for those of you who don't know me, I was adopted when I was 4 years old. So I had the pleasure of being able to get back in contact with my biological mom and dad, and they are both diabetic. A few years ago, I gained a lot of weight over a course of 10 years. And a few years ago, I didn't have a diabetes scare, but just knowing that I have a family history of diabetes predestined me, you know, to become diabetic or hypertensive or whatever my family history is. So with that being said, I took the steps to take charge of my life. And you have to take charge of your life, number one. You know, because you're going to control the diabetes. The diabetes is not going to control you. And if you are not diabetic, if you have family members that are, I encourage you to let them know that you are in control of this. This is not going to control you. So there are ways to control your diabetes. All right, so another thing about diabetes is that eating too much sugar causes diabetes. True or false?
False.
False, absolutely. Eating too much sugar does not cause diabetes. If you are already diabetic and you intake excess amount of sugar, it can cause you problems in your diabetes. but it does not cause you to be a diabetic. All right? Smoking increases the risk of complications in diabetes. Is that true?
True.
What about alcohol?
True.
Now, it's not saying, I don't encourage anyone to smoke cigarettes or drink alcohol. That's your personal choice. But if you are diabetic, it's going to increase your complication factors by smoking cigarettes or by drinking alcohol. So just keep that in mind. All right. Does anybody know? Well, let me just tell you a little bit about my company. It's called Changes LLC. And as I stated, when you are diagnosed not only with diabetes, but with any debilitating illness, anything that's gonna alter your life, you should take what word? You should take what of your life? Take charge of it, because you are in control of it. So that's the reason I named the company Changes, is because this disease brings on changes. And if you're willing to do what it takes to manage it, you're gonna have to make some changes. First, you have to be motivated. I want you to remember these three words: motivated, motivation, determination, and moderation. That last word is very, very important. Moderation. I want you to remember those three words: motivation, determination, and moderation. It's what it's going to take to manage your diabetic disease. Okay, so how many people know what an A1c is? You know what an A1c is? You want to tell us?
Yeah, A1c tells you how much your blood sugar is. Well, you know, my doctor, I go every 4 months.
Okay.
And you go every 4 months and you give blood work, and then it lets you know what percentage your A1c is.
That's right. It tells you A1c is an average number of what your blood sugars have been running for about 3 to 4 months, depending on how often you have to go back. So, do you mind sharing what your A1c is?
Yeah. Well, my doctor, she speak on me. I think the goal is 7 of low.
It is.
Is that right?
That's correct.
But she want mine at 5. I tell her, look here, I got to eat something.
Okay, so what was it?
So when I went in December, it was 6.7.
All right, so it sounds like is that a decrease from what it was before?
Yes, but
Okay,
last time it was,
all right.
Last time it was right at 7,
Okay.
and this past 4 months was 6.7.
So it sounds like it's coming down. It sounds like you've modified some type of behavior, you know, whether it's exercise or whether it's in your diet, to bring that number down. And it's not an easy thing to do. I don't know what it's like to be diabetic, but I work with diabetics, and I see them struggle all the time, you know, to try to get their A1c lowered. So if his A1c was between 6.6 and 6.8, his blood sugars averaging daily is around 148 daily. So that means when you check your blood sugar at home, and if it tells you, 148, 150, that means when you go back to the doctor and they get that small number for you, that means they're gonna say, Ms. Duggins, your blood sugar is 6.7. Your blood sugar is 6.8. We wanna keep it below 7, okay? So, some ways to modify behavior. This is what we call a portion plate. This is a portion plate. And it tells you, if you look at this plate, and I have another one I can pass around. And I'll start right here, if you can just pass it around for me. Up at here it says, yes, you can. It says, every step is progress. Take it one meal at a time. My favorite, you got this. So if you look at the portion plate, down here is where you want your larger portions. You want to get your proteins. You want to have your vegetables and your fiber, okay? Everything is portion sized. So let's say, and let's be honest, so let's say we go over to Aunt Flo's house. Aunt Flo got red rice, she got macaroni, she got some fried fish, some fried chicken, some green beans, some potato salad. Okay. All right, that's fine. Get all of it. How much did you get? because if I can eat it, I'm gonna do it. How much you get? Hold up your hand. Everybody hold your hand up. Now look at the palm of your hand. This is your portion. That's your portion size. A portion serving should be the size of the palm of your hand. Now I'm guilty, and I'm holding my hand up. Because back in the day, when I could eat like that, when I went to my mother-in-law's house, I loved her potato salad. Bam, bam, bam. And then I'll go back again. Bam, bam, bam. Then I get a carry-out plate. Bam, 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 bam. Not healthy. If I could still eat that way, I think I probably would be. Because it's there, and I see it, and I want it. Our guts have always been proven to be smaller than our eyes. Our guts have always been proven to be smaller than our eyes. So we see it, we want it. And a lot of times we get it because we see it. Just because we're adults do not mean that we don't still have that childlike behavior because I see it, I want it. Because we know that's what children do. But we tell them no, but then we do it. All right? So let's just skip for a minute. Let's talk about desserts. How many of us love sugar? No judgments here. This is a judgment-free zone. How many of us love sugar? We like sugar. We like cream and sugar in our coffee. We like sugar in our tea. We like pound cake. We like sweet potato pie. We like peach cobbler. All that stuff. We love it. I live for it. I'm going to tell you the truth. My husband and I, we cater. And one of my biggest desserts to make, which I'm limited on desserts, so don't think I'm going to walk out here taking pound cake orders. I'm not going to do that. But sweet potato pie is one of my biggest orders. And I love it. And I have diabetics that order it. And I counsel them. I don't judge them. I counsel them. I can make this pie the normal way that I do it. Dixie Crystal sugar. I use Dixie Crystal. I don't buy store brand sugar because some things you just cannot cut. You know, you can't cut on. That's Kelly. That's just me. But I tell them I can make it the regular way that I make it for everybody else, or I can make it this way for you where I use sugar substitute. What you think they tell me? Make it the way you make it for everybody else. I ain't gonna eat but a slice. It's Thanksgiving. I drink water. The rest of the beginning of the year, I flush my system out water. But the damage is already done. Because if I give you a whole pie, y'all know y'all gonna eat more than one slice. Come on. Come on. So I'm learning myself. How I changed my life is I had bariatric surgery. So with the bariatric diet, your carbs are limited. It should be no carbs, no sugars. Well, I'm not exactly stubborn, but my daddy brought me up. Just be honest about it. And if it's something that you're gonna do, just do it. Don't lie about it. If you're doing it, just say you're doing it. But don't exactly be stubborn. Just try to give a little bit. So when I went to my doctor, he said, Ms. W, you're doing good. How you doing? They always ask me, how you doing with the breads, the pastas, the sugars? I'm doing good. What about sugar? I'm still putting sugar in my coffee. Okay, how many cups of coffee are you having a day? 2. Are you putting creamer in it? Yes, sir. You still eating cake? Yes, sir. You still eating pie? Yes, sir. Cookies? Well, why are you doing this if you know that you're not supposed to do it? Because I don't want to give it up. I'm not ready to give it up. He said, are you being stubborn? No, I'm just being real. I'm just not ready to give it up. So what are you going to do about it? I'm just going to modify my behavior. I won't eat as much of it. I won't have as much of it. I won't consume as much of it. And I did good for a while. But how many of you know after a while, the amount of sugar started to increase that I put in the coffee? The amount of slices of pie that I had one in the morning. I can't eat a whole slice, but I would make sure I got I can't eat a whole slice in one sitting. So I would make sure I finished that slice by 10 o'clock, because I knew when I went home that, if I'm at work, I knew before I go to bed, I got a habit of I want to eat something sweet before I go to bed. So I knew that before I go to bed, I was gonna have some more. I'm supposed to be doing that, but I ain't perfect. God's still working on me, so I'm praying on it. You know, but I said that to say this: we are all human. You know, we are not without error. So moderation, determination. You know, these are things that if you are determined to cut that sugar out of your diet, if you are determined to decrease the amount of food that you're eating, you're gonna do it if you set your mind to it. You can do all things through Christ. If you have a strong faith and you praying and you asking God to help you, deliver you from this and deliver you from that, why not about your diabetes? Why not about the bad habits you have, you know, with eating? And I'm not judging, I'm just saying, I'm putting myself out there first. So if I'm saying, if I'm out here teaching, you know, and instructing you guys about diabetes, I'm applying it to myself first. Even though I'm not diabetic, it's still the same diet. We still consuming the same amount of food. We still doing the same things. All right, so let's talk about how to avoid the increase in your blood glucose readings, or like having a high reading or a low reading. What do you think causes that sometimes? What can cause you to have a high reading besides eating badly? Some simple things can cause you to have a high reading? Stress, absolutely. Absolutely. Stress is the #1 factor that can cause high blood pressure, increase in cardiovascular disease, your diabetes, you know, your glucose levels to be up. Somebody tell me what they do. Let's just get really personal. What do you do when you stress? How do you work out your frustration? Anybody, just blurt it out.
I go in the garden and plant.
You go in the garden and plant. What you do, sir, if you stress?
I ride, so I mean, I just ride.
You just ride. What you do when you stress? You exercise. Y'all know what I do when I stress?
I pray and ask the Lord to help me calm down.
You
Whatever
pray,
this is,
whatever
just
it
take
is.
it away from me.
Okay.
Help me to deal with it.
Amen. You know I do the same thing, sister. But you know when I do that? I'm sitting at my desk, I pull my drawer open, I pull a bag of Cheetos out, and I graze. And I say, Lord, please help me with this. I am an emotional eater. I am a stress eater. And my job is highly stressful because I manage a practice. So I'm stressed. I'm stressed at work, I'm stressed at home. Okay, I got 3 grown kids and I got 2 little kids. I had 2 sets of children. I got grandkids in between and I got a husband. My stress level is up to here. So when I stress, I like golden Oreo cookies. I'll break them in half. I get the thin ones or I'll break the thick ones in half and I'll eat a piece. I got Cheetos, the crunchy kind. I pull my drawer open. I said, Lord, help me with this today. Crunch, crunch, crunch. That's what I do when I'm stressed, but that is not a good habit. That is not a good habit. So what should I do to reduce the stress eating? What should I do? Should I not stress eat?
If you can.
Eat the right thing.
I should change my eating habits. I should change what I'm eating when I'm stressed. So why not and this is something I've done, why not get a stick of celery and eat that? You know, why not have a Ziploc bag of carrots and eat that? But you know what's gonna happen? I'll do that for a while and I have done it. But see, that is something I have to keep in the fridge. So my office is here and the break room is down there. So I gotta get up and walk all the way down there to go get the carrots and go get the celery. So after a while, I'm sick of that. I'm sick of going and walking all the way down there to get yogurt because I have too much to do. So what I'm gonna do, pull that drawer open, I'm gonna drop them Cheetos. I'm gonna go to the gas station on my break and I'm gonna get the Cheetos, I'm gonna drop them back in the drawer. Because that's convenient for me. So this is modified behavior. I have to modify my behavior if I want to make somewhat changes. All right. So what about a late or skipped meal? Do you think that can increase your blood sugar, your glucose levels? Yes, it can. Missing your meals can increase your blood glucose level. Eating too much, we've already discussed that. Forgetting to take your diabetes medication. Taking too much diabetes medication. So say you use the insulin, and you say, no, let's go with metformin. So say you're taking metformin. I forgot to take my metformin this morning. And then you double it tonight. That's too much, because if you're not supposed to take it twice a day, then if you think you forgot, then wait until the next day. It may increase your number over a period of time if you keep doing it. But with a lot of patients I found, that it's not increased just within a matter of hours. You know, unless you're just really uncontrolled. You know, your body's just really, you know, but just missing one dose is not going to cause your blood sugar to be way out of whack when you check your glucose levels tonight before you go to bed. So if you think you forgot, just wait until the next time for you to take it. Don't double your dose and try not to miss too many doses. So what about being sick? If you're diabetic, do you think that your blood sugars can decrease or increase when you're sick? Say you got COVID, why do you think so many people die from COVID? That's what they call underlying conditions. Diabetes is one of those conditions that they were talking about. Having a virus or bacterial infection in your blood will cause your diabetes to get very out of control. And then a lot of people passed away from it. Some of them may have been poorly controlled from the beginning, you know, before they got COVID. You know, so that's another thing. If you get the flu, if you get a cold, you know, that's why you have to be careful what type medication you put into your body as well. Don't just go to the pharmacy because you have a cold and you know it's a cold. You know, so don't just go to the pharmacy and pick up Robitussin from across the counter. You know, it's full of sugar. You take that, your blood sugar's increased. Always consult with the pharmacist. If you can't get an appointment with your doctor, always consult with the pharmacist. If you're hypertensive, if you're diabetic, ask what, I got a little sinus issues going on. What blood, I'm diabetic, you know, what medicine can I buy over the counter, you know, for my symptoms? Because it's gonna take, if it's viral, it's gonna take 3 to 7 days to go away anyway. The doctor is not gonna give you an antibiotic for anything that's viral. If it's a bacterial infection, depending on what it is, you get an antibiotic for it, but then again, you have to be careful because you're diabetic. Those things can alter your blood sugar. All right, so eating less than usual. So here we go. I want to lose weight. I got to get some of this weight off. I'm diabetic. The doctor said I need to lose 50 pounds. So here we go. I'm not eating nothing all day. I'm eating one meal a day. How's your blood sugar looking?
Not good.
Not good. It can increase or it can plummet. Now, somebody tell me what happens if your blood sugar drops too low. What happens? Tell me some of the symptoms. Headache, dizziness. What about shaking? Sweating. Okay, so you're able to recognize those symptoms. So say if this happens to someone in church, what would you do if that person just gets really lethargic and you know, what if this happened to Miss Angie? So what would you do?
Give her some more, piece of candy or something.
Okay, and then if that doesn't bring her around in a couple seconds, what else are we gonna do besides pray? 3 numbers. 911. Let her come out. EMS can give her an IV, inject her with some sugar water, and bring her right back. Never take medical situations into your own hands, even me. If I'm here and it happens, I'm gonna do what I can do, but I'm dialing 911. You know, because these are the trained professionals that can get her where she needs to be in a hurry. Okay? All right, so let's talk about some ways to decrease to modify our eating habits. Number 1, avoid skipping meals. If you skip breakfast, you're gonna be famished by, if you're a person that's used to eating breakfast, you're gonna be famished by lunch. So what are you gonna do? You're gonna eat more. If you skip breakfast and lunch, what are you gonna do at dinner? You're gonna eat this excess amount of food, and then you're gonna lay down on it. All right. Choose smaller portion sizes. You know, instead of getting a whole leg quarter, just do the drumstick. You know, eat slowly. We gotta have it eating fast because life is fast. You know, I do that because I'm always doing something. I'm always in a hurry. My husband told me the other day, why are you trying to eat so fast? You know you're gonna get sick. Because see, with me now, if I try to eat fast, it comes back up. Because my pouch is this big. So I can't put that food down like I used to, but I'm always in a hurry. So we collectively as a people, we are always on the go. We're in the car eating, we're at our desk eating. Even when we're home, we got a device here because we're taking care of something over here, we're taking care of something over there, we're trying to have a meal at the same time. Everything is fast, fast, fast. That's why these fast food restaurants make so much business, because nobody takes the time to actually prepare meals for the week. If you took the time to prepare your meal, say if you work outside the home, and you took the time to prepare your meal for the week, you know how much money you can save from going to those fast food restaurants, you know how much healthier you can eat, and I'm saying that because I've done it. So it is beneficial for you, it really is. Eat slowly. Like I just said, just eat slowly, don't be so quick. You know, just eat slowly and put your fork down between bites. Put the fork down. Use a small plate. Like I said, this is a portion plate. Use smaller sizes. Try it. When y'all go home for dinner today, just try it. Try it. Miss Christine, what you cook today? Nothing. We can't go to Miss Christine. Anybody cook already? I'm old fashioned. I cook my meals on Saturday.
Well, I ain't cook, but I got hands.
What's your plan?
Red rice,
See that?
white rice, catfish stew, chicken.
You're not diabetic. You got company coming?
Not you?
Okay, good. Okay, yes, ma'am. But you know, you're not diabetic.
No.
Okay, so let me ask you, does she have to
Punch
eat?
bowl.
Oh, see? Let me ask y'all, does she have to partake of all of that just because she made it?
No.
I have a large family, and I cook for people, and I cook for my family all the time. But I don't eat all that. People tell me that all the time, oh, you cook all that good food? Thank you. But y'all, I don't eat it. Because for one, I don't have to. You don't have to eat it. If you're a person that loves to cook, you know, and you love to feed, you don't have to partake of that food. You don't have to. If that's your talent, because God gave all of us a talent, if that's your talent to prepare food and feed people and make sure that they're fed, if that's your passion, if that's your talent, then do it. But you know, and then encourage them to do things in moderation. Don't cook that big stock pot of catfish stew. Make a small one. They might be mad, but it's healthier for them, you know? All right. So what about tempting foods? Foods that tempt us. If we know we're not supposed to have Krispy Kreme donuts, but we went at the food line and now they got a display, and y'all know they bring them donuts every Tuesday. Are we gonna get the donuts?
No.
All right, because if you don't take it home, it's not gonna tempt you. Even Jesus was tempted. We ain't all perfect, you know, but you in order to get past it, just resist that. Walk past it. I promise you, if you go to the other side of the store, you'll change your mind and you'll go ahead and check out. But if you hang around that temptation, it's gonna keep drawing you back, and we're gonna find a moment of weakness, which is an excuse to get those donuts, because I have done it. I said, oh, my baby want these donuts. That ain't helping my baby, but I took it home, and everybody ate those donuts, including me. I nibbled on one until I got it all down. But it's not healthy for us, but we as a people, we find excuses to do things. We find reasons to not resist temptation, and then we want to blame it. You know, well, if I would have done this, or if I would have done that, it wouldn't have happened that way. You know, so we have to, that's another behavior that we can modify. All right. Let's talk a little bit about, and we are almost done. Anybody know what this is? This little cartridge? Cartridges. This little cartridge is when you go to the doctor. What's your name?
Willie.
Mr. Willie. When you went to the doctor and they tested your A1c, this is what they used. Look at the tip of that. See that tip right there?
Yeah, but they have needles though, they give me some.
Oh, they did it through the blood. They did it through the vein.
blood,
Okay, because they
yeah.
probably sent it out. Well, if they do it in-house, if they, what we
Yeah.
call inside your doctor's office, the very tip, see how small, if y'all can see how small that tip is? That's how much blood they need to tell you what you've been doing for the last 3 months. So what they do is they stick your finger, and then they touch it, boom. Put it back on there, they put it on a machine, they run it, they get the numbers. And they come back and they say, Mr. Willie, you've been eating pie.
No, they did mine in the vein. And
Right,
blood, and they send
right.
it out
And
to the
sometimes they draw it venously and they send it out. But if they stick your finger, I'm one of them people, I'll come back and I'll say, what you been eating? Because your number higher than last time. Tell me what you've been doing. You had rice, you had sugar. They'll break down, yeah, I was doing this or I was doing that. And then that's a teaching moment. That's when I use that moment to teach the patient, okay, come on, let's modify this. you can do this. This is not something that cannot be done. All right, so let's talk now about how to check your blood sugar. All right, so we have these glucose machines, right? Everybody's familiar with this. This is a glucose machine. This is a test strip. All right, this test strip goes into the machine. Okay, another drop of blood. It comes on. What do we do with this alcohol? Tell me which finger we're going to use first.
Index.
The index finger. Why?
Because my doctor said that's the fatal portion.
It's the toughest finger you got. It's the toughest finger. Some men, I found that sometimes if they have thick fingers, you can use the pinky on them, depending on the size of their fingers, but you always want to use this finger, sometimes this finger, but this is going to be your finger. And you don't want to go straight in the middle. You always want to come on the side because the groove in your hands, you want to come on the side. You don't want to go in the middle. You want to come on the side and hit that groove. What we're going to do is we're going to wipe, okay? We're going to let it dry. And once we take the lancet, what do we call a lancet? Once we take this device and we stick our finger, what do we do next? Y'all sure?
No, you wipe it off.
You gotta wipe it off. You always wipe away that first wipe because that's not gonna give you an accurate reading. You wanna stick, squeeze, wipe away, squeeze it in, and then get the blood, and then that's gonna give us our reading, okay? All right, how many, anybody that's diabetic in here, are you using insulin? No, just oral medications? You use, okay, so, Miss Angie, you using insulin, are you using the needle or are you using the flex pen?
Flex pen.
All right, so let's just talk about the flex pen. So the flex pen looks just like an ink pen. It's just like a pen. What are our fast acting insulins? When do we take fast acting insulins? When? Right, but when during the day do we take it? That sounds like a sliding scale.
Sliding scale.
Right, if you're on a sliding scale, you want to take it if your blood sugar is large, is this number or that number. But if you're on a fast acting insulin, you want to take it how many minutes before you eat? 5 to 15. So that it can help regulate the insulin in your body so that you can consume your meal and your blood sugar is not out of control. If you're on a long acting insulin, that's most of the insulin that you take at night before you go to bed. That's the one you take. So with this flex pen, most people take it where? It's in the arm, it's in the stomach. All right, so let's talk a little bit about how we do that. So we take the top off, and it's full of insulin, right? So we're gonna put on the needle. Okay, we're gonna wipe the area. We're gonna wipe the area, and we're gonna go in, right? We're gonna turn the dial. So say she's taking 6 units, we turn it to 6, right? And we're gonna grab that piece, and we're gonna come right here. And once we go in those 6 units, we're gonna pull out? No. We're gonna let it stay, and we're gonna count to at least 10 so that all the insulin goes in. Because if you go in, boom, and once you hit 6, you pull out, it'll trickle down, and the body's not receiving all the insulin, and now your blood sugar is up because you're not administering your insulin correctly. Okay. Same thing for the needle. Once you draw it up and you put it in, same thing you want to put. I know nobody likes needles, but you're gonna put it in, you're gonna leave it there because we want the body to receive all the insulin. Okay? Now, almost done.
Excuse me, I have a question.
Sure.
That needle you're using there, that's a one-touch option?
This is CVS brain.
Okay.
But do you have one touch?
Yeah, I have one touch, but my doctor said she might upgrade something you can scan your arm with.
Dexcom. Yeah. I actually have some literature on that. I did not bring with me today, but yeah, that is one of the newer models that's come out, and you can just touch it.
Yeah.
You know, and it'll tell you what your blood sugar is. But I encourage you to check with your insurance company first and make sure that they will cover it.
Right.
Because a lot of times they won't cover those new devices if your diabetes is out of control.
Yeah.
You know, but if you're monitoring it really well and you're not having any issues with it, and you're not having to check your blood sugar at least 3 times a day, it probably won't cover it. Yeah, so check with them before you have it, call your insurance company and ask them, before you have them send over, the prescription for that. Okay. Any questions before I move on to the next part, which we are almost done? Any questions, anybody? Yes, ma'am.
My question is, my husband is pre-diabetic,
Okay.
okay? So, the doctors recommend you just check the sugar every day and all that.
Yes.
So, of course, he don't want to be checked until somebody else get checked, so I volunteered to get checked first.
Okay.
Okay? So, but my hands are very cold in the morning, and I can't get blood. Now, I drink a lot of water.
Right.
I mean, 10 to 12 bottles or more. But I don't understand why I can't get blood in the morning.
It's because your hand is cold. So what
How
you
can I warm that
what
up
you
real
do?
quick?
You can buy some warmers from behind, from CVS, Walmart. They got these hand warmers that you can buy, or you can just get a towel and wet it with hot water, as hot as you can stand it, or a washcloth. Whatever finger you're gonna use, hold it on that finger and hold it down this way.
Okay.
And this, when it warms up, go ahead and wipe it and stick it quick.
Okay.
Because it sounds like you just have cold hands, and that's okay, sometimes we do. But just warm it up first, and when you're holding that hot towel or hot washcloth or whatever on it, hold your hand down this way so the blood flows down.
Okay.
And then the same thing, keep it down, wipe it, stick it, wipe it, and get your arm reading, okay?
Okay.
All right, any more questions? All right, moving along to 2 pictures I have here. I want y'all to know that diabetes and hypertension are brothers. They go hand in hand. They hold hands. And when they misbehave, it causes your kidneys to shut down. You go into what they call renal failure. And you end up on what? Dialysis. Okay? So this is a picture of your kidneys. Healthy kidneys. Healthy kidneys. This is a picture of unhealthy kidneys. See the difference? I implore you, if you are not having any issues with your hypertension, keep it that way. If you are hypertensive and you are taking care of your hypertension, keep it that way. Take care of your kidneys. Drink water. Refrain from alcohol. Refrain from smoking. I'm not being judgmental when I say that, but this is what happens. And then we are at dialysis 3 times a week. Who wants to do that? Who wants to do that? My mother-in-law, bless her, God rest her soul, she did it for 7 years. I don't know many people that come away from dialysis. Take care of your body. Eat the right foods. Drink the right things. Take your medications as prescribed. The doctors went to school for a reason. We got common sense, but we don't have that medical knowledge. We can learn. I grew up in Pentecostal holiness. I'm going to share this and then we'll move on to the last thing. And I was taught to go to God for everything. That's true. I was taught that the doctors wasn't where we go when we're sick. We pray. But then as I grew and I learned, if you read the Bible, Luke was a doctor. Was he not? Okay? It's my belief, and I'm not just saying this because I work in healthcare. I chose to work in healthcare. It's my belief that God put us here, and he uses us as vessels. God grants the doctors the knowledge to take care of these temples, this fleshly body. Our faith is strong.
have faith in God that He will give the doctors the knowledge to take care of the flesh. Because we just taking care of this flesh. It's not gonna make you less of a Christian if you go to the doctor and help them, let them help you manage your diabetes. If you call me, if you email me, does not mean that you ain't going to heaven because you reached out to figure out how to take care of this temple. Okay? All right. Last.
Question.
Yes.
How big a role does exercise play in any of these diseases?
Any of them. Exercise plays a vital role. That is an awesome question, sir. 30 minutes a day if you can. Just walk. It's good for your heart. Gets the blood flowing. Walk. Go to the gym. If you don't want to go to the gym, get on the floor. If you can get on the floor, get on the floor and just move your arms, move your legs. Time it if you can, but try not to look at the clock. Because, when you're looking at the clock and you exercise, you go, oh my God, I only been on here 5 minutes. Just if you're sitting, we in the office, we have a specialized desk that we have that we can not sit all day. It stands, and we can stand, and we can go up and down all day long, and that's exercise for me. I get up and like I spoke about walking all the way down the hall to the break room, that's exercise for me. Those are steps that I need every day. Increase your steps. You can start by that. When you go to Walmart, instead of parking all the way up there, unless you have to, instead of parking all the way up here with the closest car, you ride that parking lot, and fight like Medea with some people because you want that spot. Park back here, lock your car up, and walk. Take the necessary steps.
Do some push-ups when you on like you been in your service, like arm and ankle. Push him up, man.
Now, Mr. Willie, I ain't being judgmental. I'm looking around the room here, and besides this gentleman over here, maybe the pastor back there, I don't know many people want to do push-ups. Miss Christine, you want to do some push-ups? But that's a good idea. That's an awesome idea. I'll get on the floor and I'll do some sit-ups maybe. But if I get face down, I might be there for a little while. Until I have to get home. On my boys, I call my grown son all the way from Greenville to come help me get up off the floor. But exercise, yes, sir.
Well, I suffer from hypertension, and I try to go to the gym at least about 2 or 3 times a week.
Okay.
And I find out the more I exercise, the better, it helps me.
It does.
And we as the black people, we eat, but we fail to exercise.
Right.
And the older we get, the more we need exercise.
Exactly.
And
You are
that's
exactly
our
right.
downfall as black people.
It is. It is. My husband and I were just talking this morning. We got me a puppy for Christmas, and I looked at the puppy and I said, when weather warms up a little bit, me and you gonna go walk around the block. He looked at me like, I've been asking you that, and you won't go with me, but you go with the dog. I said, baby, I might do it, and then you know your wife. I'll do it for 3 days, and then I'll stop. But we have to get better, at it. And my excuse is I'm tired. I leave St. George at 6:40. I get back around 6 o'clock. I don't want to. I got a 13-year-old and a 10-year-old at home and a husband. I don't want to walk. I need to get in there. I got to do what I got to do. I'm doing this and I'm doing that. That's an excuse. Because as early as I get up in the morning, I can go before work. So there are things that I can do throughout the day to increase, to motivate myself to exercise.
But one thing I found out, I sort of work part-time, and I found out a lot of time in the morning, like the gym open like 5 o'clock, and I try to go early in the morning because 5 or 6 o'clock in the evening, I don't have the
Yeah. You're tired.
energy.
Right.
I don't run out of gas.
Right.
It's best to go first thing in the morning, that way you get it over with.
You are exactly right. I am not an evening person. We had a board meeting one night at church, and it was about 8:15, and I was just sitting there like a bump on that pew. And my pastor said, well, Sister Kelly, you don't have nothing to say. I said, Pastor, let me tell you something. It's after 8 o'clock, I don't have anything for you right. I hear everything you're saying, I'm writing it down, but if you want any answers from me, you catch me first thing in the morning. You want to call me about 7 o'clock when I'm on 26, I got all the answers you want. But right now, I don't have nothing. My brain don't work well. It does not, and I just have myself programmed that way. I don't, after 7 p.m., I shut down. I'm shutting down. My brain is shutting down. My body's shutting down. I have, like he said, I have run out of steam. So you find your place during the day, during the night, in the middle of the day, in the morning, whatever time fits your body best to implement that exercise, do it. You will not regret it. All right, lastly, I have, this is a booklet that I put together for my diabetic patients, and it can be purchased. If you want one, you just let Miss Angie know, and she'll let me know. And they are $7, but they are, I didn't come here today to sell it to you. I'm just letting you know that I have it. If you want to purchase one for your family, you can. It tells you all about diabetes, A1Cs, everything we discussed today. It even has menus in here. Daily menus, suggested menus that you can do. It has a grocery list in here, blood sugar log. So let's just say, let's look at this. We have several different pages of menus, but let's just use this one for example. For breakfast, it was one I found I really liked. There is, all right, so a sample breakfast, a cup of strawberries, 1 scrambled egg, a cup of grits, 1 teaspoon of light margarine, that's optional, 1 cup of low-fat milk or soy milk or almond milk. Sample lunch, a turkey sandwich on wheat bread, green salad with light salad dressing, 1 cup melon, unsweetened tea, artificial sweetener if desired. A sample dinner, 4 ounces of baked chicken, 1 cup of mashed potatoes, 1 cup of green beans, 1 cup of sugar-free Jell-O, sugar-free lemonade. Now what are you supposed to do between between meals? I just gave you the word. Snack. A diabetic should always have breakfast, a snack, lunch, a snack, dinner, and a snack. Okay? Good snacks are raw vegetables with a light dip cup, 3 cups of popcorn. This stuff has carbs, but you notice I'm saying a cup, a serving. Jell-O or popsicle, light yogurt, calorie-free beverages. Snacks. How many of y'all know that 15 grapes is a serving? 15 grapes is a serving.
Don't do it.
So don't pick, listen, don't go to Walmart, and Publix has the most beautiful grapes you could ever see. Don't go to Publix and pick that bag up, because you would eat more than 15 grapes. You're gonna just chew them up, and next thing you know, you sitting in a recliner, you watching something on TV. I like Family Feud, Steve Harvey. I'm watching, and I'm eating. Next thing you know, the bag gone. And the only reason I stopped was because I got thirsty. Because I ate about 20 grapes. And then I looked down and I ate more than a serving. So we have to be mindful of what we're doing and how we're eating. Okay? Diabetics, you get 1 pair of shoes a year that your insurance will cover for you. I am your shoe lady. If you need to order shoes, if you have a family member that is in need of diabetic shoes, I have the catalog here. Back in the day, these shoes didn't look so good, but they got some really nice shoes now for diabetics. They really do. Some sporty little shoes. They got shoes. They got everyday. They got everyday shoes. They got little casual shoes you can wear to church. I mean, just cute, nice shoes. So if you need shoes and you are insured, you do. Unless it's Medicaid, some Medicaids won't cover it. You do get 1 pair of shoes a year. Reach out to me. Here's my card. I can take your order today but you need a diabetic foot exam. You have to have a diabetic foot exam. That is important that you have your foot examined once a year by your doctor. If your doctor does not is not implementing this, ask for it. Say, hey doctor, y'all gonna look at my feet? It should be done at any of your diabetic visits. Y'all gonna look at my feet? If they don't want to look at it, ask for a referral to a podiatrist. You need your diabetic foot exam. You need your eyes checked by an ophthalmologist. Now they're not optometrists, not just a regular eye doctor. Diabetics have to have ophthalmology visits once a year. ask for these things. Bible says, my people perish for lack of knowledge. Be knowledgeable about your disease. Be knowledgeable about things that you need to ask for, because we don't. I found that in some areas, I'm gonna just say this, some areas get better health care than others. I found that out. So wherever you are, your physician is, your primary care is, ask about your health care. Be knowledgeable about what you're supposed to be getting as a hypertensive patient, as a diabetic patient, as a cardiovascular patient, as a patient, period, as a woman. There are avenues out there for you to have. If you don't have insurance, there are government programs out there for you to get a mammogram for free, for you to get a pap smear for free. Keep up with your body. Don't neglect your body. God gave us these bodies for a reason. He expects us to take care of it. And he put the doctors here to help us with that. If there's, my card is here. If there's anything that I can answer, any questions I can answer for you guys, this is my personal cell number on here. I would advise you to text me. Because if you call and I don't know the number, I'm not going to answer. I'm just being real, because there's so many scams out here. I won't answer, but if you text me, I will get back to you. You can find me on Facebook, Kelly Duggins. You can find me on Messenger. Message me, get in touch with Angie. If you can't get me, you reached out to me and I haven't reached back, let her know. But I also have my email address here. You can email me, okay? Feel free to do so. The cards are here, and it has been my pleasure to be here with you guys today. I would love to come back. Anytime you want me back, just reach out to me. I will be happy to come back. Thank you for having me.